and it's a great pleasure for me to be in this nice auditorium and talk with you about a topic which is at the same time hard to talk about and easy to talk about. Easy, it's because most of you have some connections to this topic, and complicated because all of you have your own meaning about the topic and about the use itself. And I'm going to talk about a substance that is officially recognized as a carcinogenic. It is officially recognized as teratogenic. It's officially recognized as a psychoactive substance causing classical addiction. And at the same time, the substance is still on the food list. This substance is still sold almost in every shop in Lithuania. So I'm going to talk about alcohol. And a few words about my background, why I'm talking about this. I'm a medical doctor and I'm a psychiatrist. So I work with the patients that are addicted to different kinds of substances. And at the same time, I'm a PhD in public health. And I'm doing research in public health. I'm working with the students. So that's the general background where I work with. And I would like to start my presentation to telling that I will not talk about different kinds of alcohol drinks. I will not talk which one is the best one, which one is better than others. It's not like talk about beer, wine, vodka, or other drinks. By meaning alcohol or ethanol, I mean everything. Because ethanol in beer and wine is just the same as it is in vodka, as it is in other different kind of alcohol drinks. And I would like to start by asking you the question, would you ever agree to be treated by medication from pneumonia if you would have a choice for an alternative that would treat you from pneumonia, but in 2 years you would get the brain cancer from this medication? And probably without any explanations and discussions, you would say that you would not agree, because you are all educated and very literal people. You know the information, and you will never go for this treatment. And I'll come back to this question later. But now, let me step a little bit to the history. And today, that was already told that like 10,000 years ago, the beer was invented. I don't know the exact day when it happened, and probably nobody knows. But you can see in the pictures that those pictures are telling a story about the wine history, when the wine was produced, how it was used. So those 1,000 years of history tells that we know alcohol for many years. So probably we have learned something about that from this history. But my question would be, does anything has changed in those 1,000 years? And today I've listened to the presentations about the future, about the technologies, and you believe in technologies. That's why you are here. That's why you are, very innovative persons. But when it comes to personal behavior, most of us, we like to believe in the things that were thousands of years ago. And when you ask, does something changed in alcohol understanding? Probably yes, something has changed mainly about the design of the bottle. Most of us like the different kind of bottles that it was like 1,000 years ago. But that's probably all. And I would like to give another one example for you. Those are two pictures of surgery rooms. And first one is an old-fashioned surgery room in black and white. And the next one is the modern one. And again, if I would ask you which one you would choose if you would need to go today for the surgery, probably all of you would choose the second one. And there are many reasons to do that. First of all, is because this one is driven by the new technologies. It's an evidence-based and so on and so on. But when it comes to alcohol, again, we like to believe in things that were thousands of years ago. because somebody is saying that the doctors 1,000 years ago were treating the diseases with alcohol. And we are likely to believe in that, because that time that was true. But at that time, surgery was done without general anesthesia. Would we like to go back and to do that and to repeat it with us? And in order to explain how it happens that somehow we come to the idea that safe alcohol use exists, is that we are pushed to believe in that. Even the recommendations that are produced by public health people, produced by doctors, they tell you the story about alcohol units. And you probably know the units. The alcohol units, they are just calculated in order to compare the different kind of alcohol in order to calculate what kind of really amount you are getting from alcohol. Because a liter of beer has different quantity of alcohol than 1 liter of vodka. So 1 alcohol unit contains 10 grams of pure alcohol. So what usually public health people say, they say that it's something like, 1 alcohol unit per day is safe for adult women. And 2 units of alcohol per day, it's relatively safe for men per day. You cannot collect that till the weekend, and then they use all of them. So that's not the case. That's for the 24 hours. But still, how that happens that we believe in those things? And another one example I will tell you. And those units are calculated for thousands of people. That's, different kind of calculations. It's not personal based. It's based on the populations. So let's imagine this is some kind of new general anesthesia machine that you can find in a surgery room. And those buttons or those data that I wrote, like age, gender, weight, height, I wrote myself. If you would go to this machine, you will never find those on the machine. Because if that would be true, if the only thing needed to start this machine would to enter the data of the person, then the doctors would be no longer needed. Because, any one of us can go to this machine and push those buttons and just push the start button, and then the general anesthesia begins. But that's not like this. What happens in reality? In reality, the anesthesiologist, the doctor, comes to you the day before. And Lithuanians are joking just that the person comes to take money from you. But it's not about just taking money from the patient. It is to do something more. And it is to take a blood sample, to take urine sample, to make electrocardiography. And the doctor will ask you, what kind of diseases you had before? So it means that the doctor will make the personal evaluation, and only then it will give you a general anesthesia based on the health consequences that you personally have at that moment. So tell me how it happens that the units calculated for the thousands of people as averages comes to personal use. How will I know that this particular person, for this particular person, is safe to use like 2 units or 1 unit per day if I never ever evaluated this person personally? So that is the question, and that's what drives me to question all those surveys that tells what are the safe limits. Another thing that drives us to believe that alcohol use can be safe, because somebody is telling that alcohol can be even used as a pro-health product that helps and improves health. How way that comes to us? And being a doctor, I know only one official indication to use alcohol in a medicine. And that indication is intoxication with methanol. And you probably know the story just a few weeks ago from Czech Republic, when 20 people died from intoxication of methanol. So ethanol, the alcohol that most of us using as an alcohol drink, is an antidote. So you can save people if you would give in time the ethanol for the people that are intoxicated with methanol. So that's the only one official indication. But are there other indications? Yes, for sure. And if you would ask doctors, they will tell you that alcohol is good for your heart because wine is reducing risk of ischemic heart disease. Alcohol is good to improve your sleep because pills are bad, but alcohol is good. And there are even jokes that you can mix in the evening, you know, beer, vodka, champagne at the same time, but you have to filter water from the tap. So that's the general understanding what is good or bad. And then again, it's good to take alcohol if you are cold. And even today, when we were coming here with other speakers, it was told that it would be good to take some alcohol for one of the speakers because the speaker felt cold. So does that really work like that? And then again, if you would ask Lithuanian doctors, especially gynecologists, they will tell you that it's good to take for the pregnant women 3 spoons of brandy per day in order to reduce a tonus of uterus if that is increased. Let's go to the scientific literature. You will never find any evidence on that. There is nothing. The doctors are likely to believe in that. And again, it comes from the very old times when there was no other choice to do. And this picture is just to explain one of those myths that the doctors still believe. And this picture shows the relative risk, the association of ischemic heart disease risk to alcohol consumption. And this shows mainly that those that are not using alcohol has relatively higher risk to die from ischemic heart disease than those that are using in moderate quantities or those that are using in high quantities of alcohol. So how that comes? It looks like these studies are done for healthy people. These are not patients, they're just general population. So how that comes? Let's imagine if this substance, alcohol, would be needed for you to keep your health running, to keep you healthy. Probably that would exist in your body already, or that you could get from the natural food that is in your place of living. And another thing which is important, if that particular substance would be needed for you, if there will be a lack of this substance, you will feel symptoms. Like you feel symptoms when you have a lack or insufficiency of vitamin C, you are getting the symptoms. What kind of symptoms people have when they don't drink? Of course, they're alcoholics, they have symptoms, but we're talking about normal people, not alcoholics. There are millions of people that live all their life without any alcohol, so what? All they are ill, they are dying from ischemic heart disease all the day. Every day, all the people young dying in these areas. Is that true? Okay, if we come back to Lithuania, if that would be true, the death from myocardial infarction in Lithuania would be science fiction. Because we are using alcohol for so many years, so intensively, that probably, and you know, people say, no, it's just a very few people that are addicted. Others are using moderately. So that means that all of you would go to this slide with lower risk. But is that true? Probably not, because the myocardial infarction and stroke is the #1 killers in Lithuania, still. So probably it doesn't help. And look, the scientists, they really went to this question that something probably is wrong with that. And what they found, that the people that were taken to those studies as abstainers, most of them were former drinkers. So they already couldn't drink because of health problems. Or they reported wrongly that they are abstainers, but they were, in fact, alcohol users. So what the researchers found, that those studies are simply based on errors. And the studies that doesn't include this error and are taking the real abstainers, they didn't found those J-curve in ischemic heart disease. So would that be a time I would explain all of those myths, but this is not the reason for me to be here. And now I want to come back to my first question. You remember about the medication from pneumonia. So this is the risk that alcohol is causing for other diseases. So even if that would be true, that alcohol can reduce ischemic heart disease risk, it is increasing risk of 60 other diseases, and it's proven. So is it really ethical for the doctor to say to the patient that it's good for you to have a glass of wine in order to prevent heart diseases? So what about other diseases? And if that would be my choice, I would really think which way to die is the best one, myocardial infarction or liver cirrhosis. And being a doctor, you know, I would really choose the first one. So that's again about the choice. So is there a safe limit to avoid addiction? And I will not go into details. And I will tell you that none of today addicted people had ever planned to become an alcoholic or addicted person. All they started to use alcohol in small quantities. They do that in a moderate way, in a nice way. They were using all those nice glasses, not those, you know, sold in a plastic in our kiosks. Everything was nice. But now I have them as a patient. So there is no safe limit, and every specialist in addiction will tell you, because everyone is at risk. The only way to avoid the risk is not to take alcohol. And if you take the risk. And in fact, we talked about modern technologies and the evolution. And in reality, human beings developed some natural protective mechanisms to survive. And that's why when you're standing somewhere on a high and watch down, you know what kind of feeling is coming. You feel adrenaline coming. You feel some kind of fear, and you know that you have to step back in order to survive. So that's our natural protective mechanism. And alcohol is only taken for 1,000 years, and probably there was no enough time to develop those natural protective mechanisms to survive. That's why we're dying from those substances. And of course, you are free, people, to choose what risk to take. But if I want to choose, I have to have information. So thank you.